listening to the Pharmacy Podcast Network.
Welcome to the Sports Pharmacy Podcast. My name is Dr. H, and I am your host. I am a wellness pharmacist, pharmacy owner, and certified sports nutritionist. Join me while we discuss a wide range of topics ranging from health and wellness, sports, and even some small business secrets. Feel free to join our Discord for more interactions with me and other fellow listeners. Now let's get into the show. Welcome, sports pharmacy fans. Welcome to another episode, first one of 2024. Let's get cracking. It's crazy, right? First one.
Yeah.
I have with me Dr. Layla Javidi. She is a family practitioner out of Central Ohio, and we randomly met on TikTok of all places. She lets me make fun of my profession. I watch her making fun of, everything, which is awesome. It's fun to see. Dr. Layla, what's up, man? How are you?
I'm good. This is the first time that I am actually collaborating with anybody from TikTok, and I'm really excited about that because I feel like I love to talk about this stuff all day long, and none of my friends want to. And so now I have this whole new world of friendship where I can just put the healthcare system on blast, essentially.
That's exactly right. That's what we wanted to discuss. Right before we started recording, Dr. Layla and I were chatting about what sort of things do people want to hear about? Is it gripes between what happens in family medicine, what happens in pharmacy? So we're just going to dive into it. I have some questions that I'm going to ask her that I have not pre-shown her because I want to grill her a little bit.
Love it. Yeah.
And she's going to have some pharmacy questions for me because we could talk all day about issues with the pharmacy benefit manager, issues with payment, reimbursements, and I'm sure it's the same thing in family medicine. But let's get into it, man. Why don't you first tell us a little bit about yourself? Tell us your background, what it is you want to accomplish with this, and how your TikTok stuff is going.
All right. I guess I'm from Ohio and was raised in Northeast Ohio, just standard operating procedure in Northeast Ohio. And I went to Ohio State University. And
Sorry to hear that.
Are you a Michigan fan?
No, I'm neither. So I went to Carolina, so I'm from North Carolina originally.
So we don't even know about you or care about you. So
what you mean? Okay.
No.
All right.
You're talking to the wrong girl. By the
That's
way,
fair.
If anybody asked me that I was going to be on a sports pharmacy podcast, they would be like,
why?
Seems a little off brand for you.
We try to cover everything here, man. It's more fun when we can open up people's horizons to everything.
I agree. And listen, I like to have sports banter to pretend with my patients like I have any kind of knowledge at all. So I'm like, yes, basketball.
Do you have things that you like pre-remember just in case they ask you?
I like anything that we talk about here, I am going to take with me to the office. And
that's awesome. Yeah.
But you can't go too far down that rabbit hole or you will out yourself. Somebody will eventually ask you a question that you're like, I don't understand.
So that's a player or is that a city? I don't know what you're saying.
Exactly.
Yeah,
exactly. Sure. But yeah, so I went to undergrad at OSU, and I actually, after undergrad, I worked in industrial engineering. I worked for a company called Keyence. And I did, essentially, the sales force would sell their sensors and vision systems and safety light curtains. And I would be the one to come in and be like, this can't actually do that. And like actually help them troubleshoot, program, stuff like that. And I went through that and I was like, ugh, I just couldn't believe being a woman in that field. I was like, and especially how young I was, it was just like, nah, this isn't the vibe. It felt like all about money. So I decided I'm going to go back to medical school. Of course, I didn't do well on my MCAT. I'm working full time. I just crapped out on the MCAT and I didn't get a single interview in the US. So I decided to apply abroad. And when I got an interview at St. George's and got in, I remember crying, but not because I was happy. I was crying because I was like, God damn it. I guess I have to do this now. And I guess I have to leave. Yeah. But so I ended up doing a program where I did my master's in public health first to see if I liked the island, see if it was like going to work for me. And honestly, that year was the best year of my life. Ended up doing like a lot of stuff even further abroad at the London School of Hygiene and Tropical Medicine in the UK, working on public health stuff, mostly how public health influences girls' education. And then went back and after finishing my few years on the island with the basic sciences, came back to the United States, did all of my rotations in Brooklyn. And I was one of the lucky people who by the way, what's the swearing protocol on your podcast?
I try to keep it pretty clean,
Okay.
but
I
if
can
I need to
good
say
swear.
here, if I need to censor, I'll edit all this part out. If I need to
Well,
censor, it's no big deal. You're all good.
listen, I'm an open book, and
Okay.
if you like, I don't mind any of this kind of thing, but I was one of I'm going to say crappy. I had a crappy community hospital in Brooklyn, and
Yep.
it was
There's a lot of
actually
those up
bought.
there, huh?
Oh, it was, yeah, there's a lot of those.
If my niece is listening, she's about to graduate from Rutgers, and she wants to go to medical school, but she's taking a gap year as well. Listen to what she's saying. She took her time. You graduated. You worked even between you going to medical school. And
Yes.
what I'm hearing is Brooklyn is Brooklyn.
It's
I will not
Brooklyn, but
bash anybody from up there.
it's difficult, but I would say that I had the best situation because my crappy hospital got bought by NYU.
Oh, wow.
So I was now being trained by all NYU physicians but had the patient population, a difficult patient population. So I just learned quite a bit of medicine, had a lot of, like, I did my psych rotation in Lincoln in the Bronx, like that kind of a thing. So hardcore. So then when I came back to Ohio to do my residency, it was like, you guys think this is like,
This is nothing.
okay, pretty cush. Yeah, pretty cush. So yeah, then I graduated, went into family medicine, and now Dr. Layla is sad, and that's where I'm at now.
So Dr. Layla is sad. So let's get into this. So I
Okay.
personally, I'm not sure how much you know about me, but I own Stonebriar Pharmacy, which is a pharmacy here in Frisco, Texas. I moved to Texas in 2012, met my wife here. We built a house here. We put our roots here. So after I graduated pharmacy school in Virginia, I moved over here. And I worked for CVS for 7 years before that. So I went up the ranks. I was a store pharmacist, and I became a pharmacy manager, and then I became a district manager for a little while. I was in charge of 21 stores on the Fort Worth side. I lasted 9 months as a district manager just because I didn't like how I was treating the pharmacist. I just didn't like it. I stepped down. This was a step down in 2018. Stepped down just to become a pharmacist, worked at a busy store. And then I was like, you know what? I'm just going to buy my own pharmacy and let's just get started. So in 2019, in June, I purchased my own pharmacy. I've been growing it since. We survived COVID somehow, which was awesome. But we are predominantly a compounding pharmacy. So about 90 to 95% of my business is cash pay. So I don't even take that much insurance. I said 2023, we're about 8% insurance reimbursements. And I showed my father this. He's actually here in town. I showed my dad. I was like, hey, Dad, this is how much the insurance paid me for 2 weeks. They paid me $44 for all the prescriptions I processed into them.
Yes.
Which is stupid. I was like, thank God I don't have to rely
Insane.
on them. It's crazy. And I'm sure it's the same in family medicine. So for you, what was your passion when you were going through medical school? Did you want to do family practice, or were you thinking of going a different direction?
This is a funny little thing. I initially, when I first wanted to go back to school, I was like, how can I mix my desire for troubleshooting and problem solving and aesthetics, combine that? So I thought I would want to actually do surgery. I thought I wanted to be a plastic surgeon.
Nice.
Until I actually did. But actually, what changed my mind was, and I guess I completely missed this part of the story, in between my master's in public health and starting my first semester of medical school, I was diagnosed with stage 3 thyroid cancer.
Really?
And it was found by my beautiful doctor, Dr. Erin Hillard. And honestly, she basically did a complete physical exam on me before I went to the island. And she was like, I feel something on your thyroid. If I had $1 for everybody sent to ultrasound. But long story short, had to do treatment. Wasn't that terrible. I didn't process any of that until I was older. But it was stage 3 because it's for the people out there who are interested in pathology. It was a combined, it was papillary carcinoma with follicular variant. So essentially, one grows one way and one grows the other way, and they spread differently, but I had aspects of both. So mine was spreading hematogenously as well as through my lymph nodes. And so it was pretty intense, but not then for me. So after that, I went into school thinking, having more of an open mind and seeing what that was. And then the irony is that when I went through all my rotations, that's when I decided surgery, surgery. The lifestyle sucks here.
Seems that way.
You know what? I'm going to do primary care because it is awesome. My doctor saved my life. And the lifestyle, man, that's
Yeah,
what
exactly. That's what they always try to feed you, right?
Yeah. I went into family medicine thinking, oh, this will be nice. My hours will be just general 9 to 5 kind of thing. And I'm not going to be dealing with like major crises all the time. And boy, was I wrong. I thought that family medicine was going to be a lifestyle that was something that would, accommodate a family. Boy, was I wrong. Boy, was I wrong. And over the past few years in my private practice, did I realize that it is insurance companies extracting capital from the system, all the middlemen, and it just keeps piling up, all the middlemen that are taking money from the system and preventing us from paying our employees a livable wage, not even a reasonable wage for the work they do. And after COVID, it just got really intense with all of the distrust of the healthcare community, and especially having my master's in public health and epidemiology, I thought, I'm ready, coach. See, sports.
Yeah.
I'm ready, coach.
There you go.
Put me in. And honestly, I couldn't believe how nobody wanted to or cared to hear what experts had to say. So between that and then a couple tragedies that happened in my life over the couple of years, my ex was in a devastating motorcycle accident, and my mom had passed away from complications of lung cancer.
It's been a mess, man.
It's been a mess. It's been a mess. It's been a mess. And after that happened, and I realized how messed up this system was, and I realized how I could no longer function as a doctor that is seeing 25 patients in a half day. I just was like, I was hopeless, didn't have my mom, didn't have my ex. And I was like, where do I go for help? And I just started making funny TikToks about stuff. And here we are.
It's remarkable how the internet can be such a great thing where it helps. Like, for me, Dr. Layla, I'm a huge proponent for mental health and mental health awareness, just because I've struggled with it my entire life as well. So it's something that some people can find solace in, other people, like meeting people like us, the way we met on the internet, like helping each other, that the best that you could do. And there's a lot of cool people on the online that really share their ways of how to deal with tragedy, how to deal with trauma, how to deal with just general anxiety, which is really cool. Not everything, like we'll talk about, it doesn't have to be medicated, right? It could be just as simple. Like, my thing is, if I don't journal like in a day, I drive myself crazy. Like, I need something to just write down, just even if it's today blue, I don't even care about this anymore. I want to figure out what to do next, kind of thing. So that's, it's something that helps people just put something on paper. And I've shared this multiple times on here, is that I've, even through pharmacy school and after owning a business and everything that I've had to go through, like, the anxiety is always going to be there. And people have had to get help. I've encouraged people to go seek therapy when they need to. But it's really important that we say that just talk to somebody. Like, just be a bro for somebody is what I say. Just, that's all you got to do. So I appreciate you sharing that with us. That's really important. But let's dive in. So the whole purpose of this is that we want to air grievances between pharmacy and family practice. So I have a couple of questions I would like to ask Dr. Layla. And then I'm sure she has something she wants to ask me about whatever pharmacy. I'm sure. Great. I'm excited. This may be a continuing thing, but we'll dive into it. So Dr. Layla, what is your favorite thing about your job?
I would say my favorite thing about being a family medicine physician is literally treating families. I had a romanticized view of being this roll up your sleeves, old timey doc, spending time. Hey, Billy, how's your dad? That sort of a thing. And I do have that, actually, despite what my TikTok shows. I have amazing relationships with my patients, and a lot of my grievances are not things that are happening directly with me and my patients. They're actually other patients in the practice that are not mine, or ones of mine that I haven't yet established boundaries with. But I love families. I love knowing what's going on in the family. I love being able to help, knowing the bigger context. That's my favorite thing. And spending time and getting to know the big picture of their whole self, mind, body, spirit, which is one of the reasons I'm so sad, is because I feel like I am not incentivized to do that in this fee-for-service model, where the only way to get reimbursed is by having more and more appointments. I really wanted to treat mind, body, spirit. I wanted to do all that. And unfortunately, the reason why I am sad is because I am not incentivized to do it. In a fee-for-service model, most people don't realize the only revenue that is generated by a doctor's office is through appointments. There's no other way. So if you don't cram in your appointments in a day, you can barely pay the overhead cost, which keeps going up and up. Inflation is increasing for everybody, but the reimbursements are actually decreasing in absolute value. Like they're actually decreasing.
So what we're watching, and I'll speak about pharmacy, but I'm sure it's going to apply for you as well, is that we are the only service model where we don't get to set our prices. Somebody else sets our prices, meaning that every other business will say, hey, you got to pay $12 for this product. I said, hey, I would like to get $12 for this product, but they'll only give you $6. So we're the only business in the world that happens. It makes no sense that I can't even decide how much I'm worth, and you can't decide how much you're worth as well. And I have, just to follow up with this. So here in Texas specifically, I live in a very affluent community. Like we got the Cowboys facility down the street. So a lot of our providers here, they're actually transitioning into more of a concierge model where their patients are paying upwards of $5,000 to $10,000 a year to be their doctor, and you have 24/7 access to them. Have you thought about that, or is that something that could work in your area? What do you think about that?
I have thought about it. It's really interesting that you're asking me this right now, because I'm actually making a big pivot in mindset. One of my reasons why I really had a problem with that was, especially now that I have a full patient panel of between 1,500 and 2,000 patients, and I accept all insurance. There's not a single one. There's one Medicaid that I don't accept because I'm not credentialed to, and I think it's just like we pay them to take care of.
Of course, yeah. Welcome to Medicaid.
Yeah, exactly. That basically, I always thought, I don't like the inequity. I feel like I don't really want to be serving a population that feels like they can buy me and tell me what I want and this and that. And I want to still give access to people who that may be cost prohibitive. But this is the key here that I've realized is in this current model, they are not able to, that population that I'm so concerned about equity is not getting treatment because they're the ones that may need an emergency appointment, and they're the ones that don't have the bandwidth to wait on hold or to call again and advocate for themselves. So the people that I end up seeing most often are ones that are not in that population. I've been thinking about either a hybrid membership type model. Different places do that. MDVIP, Amazon's One Medical does that. Or a direct primary care, and that would allow for direct payment to me like we talked about instead of somebody else setting the prices, and then be able to subsidize a small group of patients that I feel are deserving of that care. Maybe they're complex Medicaid patients that I want to take care of. I think I need to transition there, but I can't even get there because I'm in like $150,000 of debt to my practice.
That sounds right. I get it, man. It's crazy the amount of money that can fly around in healthcare in general, and like people like us, where we're just like, hey, man, we're in the business of taking care of people. Like that's part of the reason why I became, an independent pharmacist. So, if I were to ask you, aside from reimbursements and everything, what's the toughest part of your job? What is it that you really dread?
Insurance out of it?
Yeah.
I would say if I took insurance out of it and I took care, I guess I'll start with the tiers. The next layer is the care coordination aspect of it in a system that has limited resources. We have people who want to get into a neurologist for their tingling in their pinky finger, but I've got a girl who I'm like, you 100% have some kind of ALS, MS, something is going on, and I cannot get that person to get into their specialist because of the weight and all that stuff. So that aspect is difficult. But if I went to the third layer, it's dealing with stigmas in the way that we treat end of life care. That is probably the most difficult part. especially in the context of having very little time with patients to establish their goals of care and to really understand what they want from their care. That I would say is the hardest thing that I deal with.
I didn't even think about that. That's such a huge part of life, is just like, how does the end come about? Listen, I have so much respect for doctors, man. I thought I was going to go to medical school. I got in and I was just like, I can't do it. We all work way too hard, and for, I would say, not as much respect as y'all deserve. That's one thing. And I'll share a quick note about my doctor. So I started subscribing to one of these concierge doctors, Dr. Brian Lowry out here. He owns Frisco Concierge Medicine, a great friend of the podcast. I met him when he first started his practice. My pharmacy was right next to his practice. And we just chat. We'll say, hey, what's going on? Let's go play golf. We'll just shoot the shit. Nothing like intense. And one day, my wife and I just got back from Turkey. My wife is Turkish. Oh. And I felt like garbage. I didn't know what was going on with me. I just felt like I was peeing all the time. I was like just really sick. At that point, I'm 6 foot. So at the time, I was like 275 pounds. I was pretty heavy set. And I went up to him. I was like, hey, man, I hate to do this, but I feel like garbage. I don't have a PCP. Like, I don't have insurance at the time. So I was like, do you have any thoughts of what it could be? He didn't even hesitate. He took me into his practice, took all my blood work, did all my physicals, did everything for me, didn't ask for anything in return, didn't ask for money, nothing. And come to find out, I had an A1C of 12. 12 was my A1C. God. Oh, it was bad, man. That was real bad. My fasting glucose was over 400. I was in horrible shape. And he took me in. And it wasn't until that I pushed, I was like, hey, man, I know this is what you do. I would love to be your patient. You saved my life. Like, I would like to do this. And look, thankfully, working with him, man, I completely reversed my diabetes. I'm not on any medication. My sugars are all normal. I work out 4 to 5 days a week. And so I owe him my life. And that's part of my passion when it comes to PCPs, is that I feel like y'all are unrecognized when the specialists are out there doing all these crazy cool things. But the PCP is just such a foundation for healthcare that we in this country, we don't encourage preventative medicine. Like, we encourage, I had to go see him because I'm a healthcare professional. I should have known better, but I still had to go see him just to figure out what was wrong with me. And so that model, I think, is missing. And that's the cool thing about what he does, is that his patients have to see him every 3 months or else they're kicked out. Like, you can't, I don't want to treat you. So he makes his patients come see him. And of course, whenever you need him, you can text him and he'll be like, yeah, I'll send it to you, whatever you want. But generally speaking, even if it's like an infection or anything like that, if you need an antibiotic, he doesn't like to give antibiotics without actually seeing the patient, seeing if he really needs the antibiotic. Good. So he does it correctly. He capped out at like 95 patients or something like that.
Oh, wow. That's amazing.
Yeah. So it's really cool what he does. And this is a shout out to Dr. Brian Lowry. Thank you for saving my life, man. But anyway.
That's amazing. It's so interesting that you bring that up. That is one of my favorite things, actually, is getting people off diabetes medications. And one of the biggest things that, if I can get their trust, especially people who their first A1C is 12, I'm like, I know that you're going to be really hesitant to do this, but if we do insulin and metformin, like if we do it rigorously, we give your pancreas a rest and you make these changes, I think that we can get you off this medication. And I try, because a lot of people don't want to get started on stuff because in their minds, they just see it as, I'm going to be on this the rest of my life. But if you lay a pathway for them that says, no, this is in your control, but just like if you were to break your leg, you're going to get better, but you got to use crutches. You can't walk on that broken leg. You got to give your body a chance to recover. So I love that. And I have numerous patients who have gone from A1Cs over 10 to now in the 6s, controlled with either nothing or just metformin alone. And then right now, of course, we're using all the GLP-1s as we're able to. But I've noticed that they're not as popular with the diabetics. I have numerous patients that once they commit to making the lifestyle changes and they allow the trust to do the insulin in the short term, many of them their A1Cs are in the 6s with no medication or metformin alone. Or I was going to say these GLP-1 agonists, which
that's a whole other thing.
I can't wait. Yeah,
we'll save that for another episode.
That could be
that's an episode. Yeah, we'll do it. We'll do GLP episode one time. We've had a deep dive so much on that. I am an Ozempic person. I'll be proudly to tell you that I lost after starting the medication. I'm down 40 pounds. So I'll tell you.
No,
But
it's an incredible medication. I really think that the hesitation with it, I published a video about this. The
yep.
hesitation is really just the hassle because because once you dig into the evidence of it, it is truly a great medication. But can I reverse a question back on you,
Yeah, let's
Mr.
do it.
Doctor Compounding Pharmacist? So, what if I were to advise people who are let's start at it from a person who's running an aesthetics clinic and you're going to decide to do compounding GLP-1s. Now, we know that
Yep.
the FDA has basically said this is not regulated. I know Novo Nordisk is doing cease and desist things. I don't know if Eli
Yep.
Lilly is for
They are.
tirzepatide, but so what's your prediction on here's a 3-part question, Dr. H. What's your prediction on how long is this bubble going to last? The second thing is, are there questions and things that a doctor can do to ask a compounding pharmacy to see if they're
Yeah.
I guess we'll start with those two.
Yeah. So first, it's always important. I always encourage every PCP to have a go-to pharmacist where they can ask this question locally to them, because they're gonna have their ears to the street, right? They're gonna know what's going on everywhere. The most
Yeah.
important question I always tell providers to ask their pharmacy: are you using the semaglutide salt or are you using the actual USP base? So that's the difference. Is that some people that are using the salt sucks, awful. Like, you get that stuff from overseas and it's not great. The semaglutide powder that I've seen being sold that we had was that we were able to first see the certificate of analysis. So I see everything that's in it, what it should look like, what percentage. And this is something that every provider should ask for any of their compounds. Hey, do you have a COA for this product? That's always important. That's number one. The second part is to ask, what are your dosages? Are you adding vitamin B to it? Is there any sort of lipoproteins that you're adding to it as well? Because that tells you that they actually took care and wanted to see, hey, we want to help our patients, because whenever you start the semaglutide, one of the main side effects is that you're going to have low energy because you're not eating as much. And to counteract that, pharmacies are adding vitamin B complex to their injections to help with that. So that's number one. That tells you, A, they're doing their homework.
Would you say, though, that is an impurity that shouldn't be in there? What do you think?
When they add it in there, now these companies like Novo Nordisk and Eli Lilly can't say anything because you're actually mixing it with something else. So it's not pure semaglutide. So, for example, like we have to make products that are a little bit different from what is actually commercially available. And so we add stuff in there. Like, for example, we make a tadalafil, like a Cialis, but I add arginine in there because it's not going to be just like what they have. And I know it's a good protein that helps with absorption of Cialis. That's why I like to use it in my capsules. And so things like that, it shows that they care, that they're doing their homework, and they're not in it just to, this is just semaglutide, you got to pay the X amount of money. The fact that they're adding stuff in there that's going to help the patient, the better it is for them. Lipoprotein, vitamin Bs have been used for a long time, even before all this, just for energy, just for weight loss and stuff like that. The fact that they want to add it with the semaglutide is, to me, the best option that they could do. Making sure you know where it comes from, making sure you know they're not using the salt. So there's like a semaglutide sodium. You want to avoid that one. That's a terrible one. And making sure they're using
certificate. You said this is the part that I don't have, right? I don't know this certificate of ingredients. Is that what you said?
Certificate of analysis.
I need to write
every powder we get, and no matter what it is, use oral, topical, it doesn't matter. I always get a COA to tell me it is 99.8% this, what else is in it, where it came from, temperature, storage, precautions, batch, lot number, and stuff like that, just in case there's ever a recall.
And how are compounding pharmacies regulated? How do I know that their COA is actually legit? Because that's something, I don't know if you read Bottle of Lies.
Yep.
Did you read it?
Yeah, I have. Yeah. So
that went, and I was like, oh my God, all of our stuff is from places with endemic fraud and where the exploited, impoverished people are faking. Anyway, I'll take my tinfoil hat on.
That's all right, man.
Answer.
The injection pharmacies, the ones that do like injections like semaglutide, they have something called URAC accreditation. And so they're inspected regularly. So they have the board of pharmacies usually regulating them every year. And then on top of that, they're actually getting inspected by outside organizations, different accreditations. For us, we're PCAB accredited. So we have this company called PCAB come and regulate our stuff to make sure that we're keeping things clean. We're documenting. We have training. Like there's a whole list of things that they always double check. And it's always a surprise visit. Like we never know when they're coming. And so it's why you want to make sure all your ducks are in a pond in a row just at the right time.
And how do you get these powders? Where do those come from?
Some places you can, some places, right? It's like the cheap ones, obviously you can, but there's some companies that we trust. For example, our pharmacy is sponsored by Fagron, which is a huge company that is very strict about where they get their powders from, how they test it, they're lab tested and everything. And then whenever we make a compound, Dr. Layla, we send it out to a company to lab test it as well to make sure it's got the right stuff in it, the proper concentration, and it's safe to use. There's no bacteria impurities in there. And pharmacies that compound should have all these on file.
I feel like this is an important thing to underscore for anybody who is either in a med spa. Let me just tell you, I actually oversee 2 cosmetic injectors. Nice. And I am very strict about what we do. And they've been asking me to do this. And I am like, I refuse to be a doctor that is just one that is just like, yeah, I'm just going to not pay attention to any of this. Yeah, sign this and make the money. No, I want to see all their charts. I want to make sure that we're doing it right. I want to make sure the compounding pharmacy is good. I want to make sure they have informed consent about the whole FDA situation. Good. And then on top of it, make sure that it's just on the up and up. And so I was very uncomfortable with that. And now I have a lot of information now to move forward. Because I did see that I think it was a doctor in Texas that is currently being. Yes. Tell me, what do you know? I just saw a headline and that's all I know.
I don't know if I don't really want to get into it. Just mostly because like I have, I help doctors with this all the time. So it's. I'll just say, just be smart.
Be smart. Do your charts. Exactly. This is internal medicine. What I told the NPs that I oversee, I said, if anybody treats semaglutide or tirzepatide like injections, like it's not internal medicine, they are foolish. You truly need to be aware. And also the BMI requirements, like there's some med spas that are giving it to people with a BMI of 22.
Yep. And I want to make sure to say this because I don't know if it's the same problem for you guys up in Ohio, but please don't get medications from a chiropractor.
Oh my God.
Don't. Yeah. That's one thing that pisses me off about TikTok. It's like, I have been banned by so many because I will straight up call them out that they're sitting there calling themselves Dr. Whatever. And all you had to do was get a damn certificate that says, oh, look, I'm a associate's, whatever. And they're giving advice on like thyroid therapy, hormone replacement therapy. God. Bro, you're a glorified masseuse. Why don't you step back? Step back a little bit.
I've gone to the deep dive on the accreditation thing with chiropractors in the different schools. And I actually think I might make a video about it. Yeah, because the issue is, it's not that all of them are bad. In fact, there are some that are very educated. There's some schools that do a very good basic sciences. But the credentialing, what each state requires from them is so different. Some of them need a bachelor's degree, some don't. Some of them need to take step 1, step 2, step 3 of their chiropractor exam. Some just need 1. It's literally a crapshoot. So somebody commented on one of my videos when I was talking about the people who deserve reimbursement, because I was talking about provider status for pharmacists, and somebody commented, "You forgot chiropractors," and I said, "I don't say the C." I said, "Yeah, I was like, I don't talk about the C word." And he was like, "Oh, I understand. They make you feel insecure." And I said, "Yeah, insecure like riding on the back of a motorcycle with no helmet and not knowing who my driver is." If that's what you mean by insecurity,
of course, but you had to say that because your whole ex thing. Oh my God, Dr. Layla.
Yes, and that I have a very dark sense of humor. But seriously, like literally, like that is.
Lost her again. We'll be right back.
Now I just restart it and come back in.
It's all good.
I feel like it's like
all good.
Anyway, though, yeah, chiropractors, it's not okay. It's just like compounding pharmacies have some things like that, as well as doctors, the obesity clinic, the crap that they're exploiting patients with. I actually will go, if there's a Groupon for a laser lipo thing, I will purchase it and I will go and I'll see what they're doing. And I can literally, I went
And you
to
don't tell
one
them what you are, right?
No, I don't tell them who I am.
Smart. I'm going to try that.
I'm just like, oh, yeah. I haven't shared my weight journey either, but I struggle a lot with that. Yeah. And currently I'm just in a mental health crisis. So that's look at Layla. She's lost almost all of her mental health. But anyway, that's just where I'm at now. But this one place, they put me in like a tanning bed that had a red light, and then put me on a vibrating machine to shake out the fat cells that were melted in the tanning bed.
And people pay for that stuff. People pay lots of money for that stuff.
Yes. And so then I asked after, I said, I want to talk to the physician. I want to talk to and they were like, the nurse practitioner's here. And I'm like, does she own this? And it was like, no. And I was like, I want to talk to, it turns out the owners were in Florida, and I think were not physicians. I think they were chiropractors, but sometimes they are physicians. Sometimes
they call themselves that too. They call themselves a physician. Like they'll sit there and say, oh, I'm a clinician, or whatever bullshit they want to sit out there. But bro, that's a whole other thing. I don't want to bash an entire. I know good chiropractors. I know really quality ones. I go to one sometimes, but I don't go to a garage to fix my boat. Right. I go to it's different stuff. Right. There's different things that they do. But shout out to the good clinicians out there. If you're one of those wellness people on the internet that want to try, and we have a chiropractor here that'll prescribe testosterone straight up.
How? They're not.
They have a medical director that they write the prescription under, and they don't even see the patient.
Perfect. Yeah. And that's because honestly, really we're placed, going back to the original kind of thing, we're placed in these positions. I know for me personally, especially going to a puppy mill medical school where they charge an arm and a leg to bribe the state of New York to allow us to rotate there. The loans that you get, some of them are FAFSA, some of them are federal, some of them have to be private loans. Yep. And when I went in, it was 2010, and that was just post housing market crash. My interest rate for one of my loans was 11% and accruing interest as I was in school. I currently have $500,000, not an exaggeration, $500,000 in debt right now. And at some point, what are you going to do? I'm very
we never apply to these loan deferments or everything like that because we make too much money, right? We never get that luxury. Yeah.
Never get the luxury. And the only way that you're able to do something is if you work for a federally qualified health center, or if you work for a 503c hospital that is a nonprofit. And a lot of those situations, they are exploiting your labor. So it's, you might get in 10 years, you might get your debt eliminated, but to what cost? At what cost? Yeah. Wow. And who knows if that loophole will be closed by the time you get there. That's scary too.
It's a lot of money that flies around healthcare. We've talked about how much things are being used. We have time for a couple more questions, Dr. Layla. Anything that you want to ask about the pharmacy world?
Oh my God. Yeah, tons of stuff actually. But I guess what do you think about, what do you know about, is it truly the DEA that is choking off the supply of amphetamine substrates right now?
I'll tell you exactly what's going on. I know exactly what's going on. If you go on the internet and just Google Adderall medication, just Google it. You'll find a list of websites of where you could go online, meet with a doctor, and get a prescription of Adderall all in one time. And so for us, they're ordering all of it because the FDA has always regulated how much you can order, no matter what. The DEA can regulate how much you can order and how much a wholesaler can hold. So these online pharmacies are purchasing everything and leaving nothing for us. That's really
so the demand has gone up in the pandemic.
Oh yeah.
And these are other predatory places too. There was, I won't name any because I don't want allegedly. But there's some of these places that essentially their business model is to diagnose you with ADHD, to prescribe Adderall, essentially just like it's another pill mill. And I believe we're responsible as in, I have a very strong moral compass with this.
Of course.
And I feel like it is imperative that we prevent the next opioid crisis, which I do believe is going to be an amphetamine crisis. And yeah, but what about why certainly what's with the supply chain issue right now? I feel like if there's money to be made, there should be some factory that wants to make more for all these things. Wegovy, Zepbound, Adderall, all these things. What's going on there?
So I know that Eli Lilly specifically, they're going to start doing direct to consumer dispensing. So meaning like you can get your prescription through Eli Lilly, so you can get your drugs right away from them, which is great because if I fill it, if I get the actual Ozempic or whatever, I lose money every single prescription. So we don't even care.
Pharmacy benefit managers.
Yeah. Let's not get into that. I don't want to lose my job.
I know.
But
yeah, I've been procrastinating editing that video.
So I think it's good for come from direct manufacturers because it eliminates the wholesale costs. It eliminates like PBMs trying to regulate how much they can charge for it, XYZ. That's great that they're going to do that because patients need to use it. I'm a firm believer in using it safely and doing all the right things around it, which during our GLP-1 conversation, we'll get deeper into it. But the supply chain, like, for example, we are a huge hormone replacement pharmacy. We do a lot of hormone replacement. And I rely a lot on progesterone. And for some reason, progesterone 200 milligrams is out everywhere. I don't know why. I can't figure out like why it's so hard. Like when I order 24 bottles at a time, just because I have that many patients on it. And for a company to start making more and to increase their supply, they have to reapply under the good manufacturing practice, GMP, and say, hey, I'm making more of this for XYZ reason. Then they have to get inspected, and then they have to get regulated all over again. So it's a process that lags behind. Another medication that we use all the time is NP thyroid, which is actual thyroid desiccant coming from bovine. That has to be regulated tightly as well. The only best way to order it is direct from the manufacturer. So I order direct from the manufacturer, so I know that their batch is correct, it's been treated the right way, and if there's ever a recall, I go right to them. They send me new stuff back. So that's why I like to do that one. And so the wholesalers and the PBMs are in charge of negotiating pricing. So the PBM is like, all right, I'll put this drug under our formulary if you give it to us at a much cheaper rate.
And we'll give you a rebate. We'll give you
Exactly.
$500, but we won't pass that savings on to the consumer.
That's the issue, right? So they're doing that to save money, but the idea was like, oh, we'll make it cheaper for the patient. No, we'll leave the same price. We'll just pocket the rebates.
And we won't reimburse the pharmacy for even the price that we've negotiated.
Exactly. Yeah. I'll send you a picture later. I'll send you a picture of how much I lost in a 90-day prescription of Januvia. That's a whole other thing.
Oh,
that's starting this year. It's crazy. But
what's the solution, Dr. H? What's the solution? Is it the DEA? Do we need more people in the FDA? Does this need to be a health crisis prioritized? Is this where do we fix this supply chain issue? I know definitely stopping relying on foreign manufacturers should be a huge priority, but where do we begin and how do we tell our listeners and whoever how they can get involved in fixing this?
So I know in Florida specifically, they just accepted, the FDA is allowing them to import medications from Canada, which is a huge help because Canada's system for accepting medications, drug medications is very stringent, but they also get it much cheaper because they're able to get it from a larger source. And I think you froze. Yep.
I'm calling Spectrum.
Hey, welcome back.
I'm hopefully you got your full stream of consciousness. I heard you're going to call Canada.
I kept going.
But
yeah, so getting stuff from Canada is cool because they regulate things a lot tighter than we do, and they have certain practices that they double check XYZ stuff. So they're really good about making sure their stuff is from a good source, and it's a hell of a lot cheaper. So the FDA is allowing Florida to bring their stuff in, I think just to test the waters kind of thing. There's no money for wholesalers and manufacturers to make medications. They're getting tightened so much as far as like their workforce and stuff like that from the PBMs that there's just no money for them to do. Where's the incentive for them to make more medication when they're making pennies on the dollar for, let's say, hydrocodone or Adderall for that case?
So it's PBMs again. It's PBMs.
Allegedly.
And we didn't name any of them. Of them.
True. Yeah, but the solution to the PBMs is easy. Transparency. Just show people what you're doing. For people like me, I will show online saying, hey, this is how much I got paid for a medication. Yes. I'm about to lose $200 just for filling this one prescription for a patient.
Yes.
Whereas, like we talked about before, I don't set my prices, so I can't see what they're wanting to charge. Mm-hmm. Not just that, at the end of the year, they're going to start doing something called DIR fees, where if a patient hasn't been picking up their medication the right way or anything, they have a certain percent of your payments that you've received will go back to the PBMs and DIR fees. Crazy for Medicare patients. It's wild.
I'm writing this down because I'm like,
yeah, dive deep, man. Dive deep. You'll see.
I just can't even handle it. And I think that people don't understand what PBMs are at all. And because of that, it's so difficult to get anybody to lobby for change and reform. So I think that should be on a priority for me, at least, to try to educate. But
unfortunately, a lot of the politicians are paid by these drug companies. So there's no incentive for them. I had a meeting with my congressman here, and I showed him the amount of money that they were making and stuff like that. I'll call this asshole out because I frankly don't like him at all. What's his name? Van something. He got in trouble recently. Like he got kicked out of Congress for having he had an affair with the ISIS queen. Like,
not J.D. Vance. No, that's my state.
No, that's your state.
Yeah, that's my state.
Vance, yeah. Vance something. Anyway, piece of crap guy. I had a meeting with him. Dude just brushed me off completely. And I was like, bro, I'm in your congressional district. I am a business owner. I'm a Syrian American that lives in your state. And you can't even listen to me? He's like, bro, go get out of here, man.
I think that the big answer is Citizens United, which is the super PACs. As long as people can donate, as long as it costs $1 billion to run a campaign.
Van Taylor. Sorry. Van Taylor.
Okay, awesome.
Yeah.
Good.
Did you hear what happened to him?
No.
Yeah, he had an affair with this ISIS leader's wife.
That's insane.
Like the terrorist organization.
That's insane.
And I was like, bro.
What are we doing? What are we doing
crazy.
here?
Because he had me on his Twitter. Like he put a screenshot of us talking on his Twitter. And I was like, hey, man, can you take this down? Because I want nothing to do with you. I was like, just take my face off.
I want nothing looking like us. And,
exactly.
I'm Iranian.
Yeah, that's right. I forgot. Half Iranian, half German.
Yep. Mm-hmm.
There you go.
All the loved people of the world.
Yeah. So I hate to wrap this up. We're going to try to make this a monthly thing. Dr. Layla, where can they find you on social media? You
can find me at Dr. Layla is sad. And I guess that's really where I am right now. So
man.
I guess I have a Threads that I should have looked up. I have a Threads. I think it's probably Layla.
It's your Instagram account, isn't it?
It's connected to my Instagram account. I guess my personal Instagram. I think I haven't processed that part yet. So right now, Dr. Layla is sad is where you can find me, and I'm planning on possibly going to YouTube and finding a way to make it. I need to find a way to cross upload things to other platforms, but really, I didn't expect people to care about what I had to say. So
it's cool. You have good information, man. I love your TikToks. Your TikToks are. I know you've had no problem calling out stuff that you don't like, so I always appreciate what you do online and stuff like that. So please check out her TikTok. She's a great follow. And by the way, here's my journal. I always keep it right next to me. I know our audio listeners. My journal's right here next to me.
I love that. I have my journal.
There you go.
I have it's a digital journal, and I'm
smart. I have horrible handwriting. It never works for me there.
Oh yeah. We could talk about that. I've got all kinds of methods to get better.
Sweet.
Yeah. But awesome. Dr. Layla is sad. I don't know. We'll see what happens in the future. I might do a podcast. I'm not sure. I'm trying to figure it out. I actually have an idea for a podcast. I know you're winding this up, but
it's all good. You're good.
I don't want to share what it is on here because I don't want to get my ideas taken. but I
Yeah.
do have an idea for a true crime podcast that is medical. And I think I am the perfect person to do this. So I can't wait to start working on that and tell you about that.
Can't wait to hear about it, man. It's Dr. Layla Javidi, family practitioner. I appreciate your time, man.
Thank you so much for having me. I look forward to coming back.
Yeah, we'll see you in a month.
All right, we'll see ya.
Thank you for listening. If you enjoyed the podcast, consider giving us a 5-star review anywhere that you get your episodes. Follow us at Sports Pharmacy Pod, as well as me, your host, at Dr. Mix-a-Lot. Join our Discord server for more interactions with me and fellow listeners. As always, stay well, stay hydrated, and I will catch you next time.